We have only large intestine specimen of the vermiform appendix only. So, large intestine specimen is basically of two types. One is large intestine general and other is like a vermiform appendix. These are the two specimens, but commonly popularly vermiform appendix is more frequently given in the exams. So, we have this particular one specimen only to identify the vermiform appendix, but theoretically we should be knowing this particular large intestine as well. So, to just like go through this particular abdomen that we had discussed with many times about like the general outline of this microanatomy of the intestines is that having four coats or four layers. Keeping the lumen inside, we have the most inside layer which is known as the mucosa, then submucosa, then muscle layer, then adventitia. The same rule sticks here as well for the large intestine. As per this particular large intestine, the special feature of the large intestine which separates it from the small intestine is that it is larger in size or width, I would say, and it is not that super coiled that the way you see that like small intestine which is really coily. This particular large intestine have got features, we call them as this particular muscular bands as tinea. So, this particular tinea, there are three such muscular strands are there which helps to identify this particular large intestine. So, it is covered with this particular peritoneum covering. If you just like bridge this peritoneum covering, then this particular tinea is visible for us. Second thing is that this particular narrow constrictions are there, we call them as haustration. That means narrow constrictions and dilatation, constrictions and the dilatations are there, we call them as haustrations. So, these particular haustrations are there. And third thing is that starting from this subserous or this adventitial layer, we see a fat pouch which is popping up, this particular things which is known as the fat pouch. We call them as epiploicy and appendices epiploicy. They look like a worm like pouch. That is why they are known as appendices epiploidy. They are filled up with fats. So, they are coming from as a bulging from the outermost coat or serous layer or adventitial layer. So, this particular muscular band we call them as tinea, tinea coli, three such different bands are there, and haustrations or circulation dilatations which is present in this narrowing and dilatations, and we have these fat pads. In general naked eye we can figure it out. So, whenever you are studying this particular microanatomy of this particular large intestine, they are also having the same. You have a lumen inside, then this particular have these four coats there, mucosa, submucosa, then we have the muscle layer, and then we have the serous or outside layer. Outside layer we may see fat plenty present in it if you are seeing the most outside layers. Now, talking about this particular features which separates this particular microanatomy of the large intestine with the small intestine, that the hallmark for identification of the small intestine is presence of the finger like projection, we call them as villi. So, which is kind of like a very unique for the small intestine. The large intestine do not have that kind of villi. So, there is absence of the villi with having four coats which is lumen circled in between which is present in here. So, absence of villi it is there. Apart from that, this particular projections we call them as evagination. We have this burrowing thing, we call them as invagination, we call them as crypts of Levercon, which is the glands, which is intestinal glands is there, that is present in the large intestine. So, absence of the villi with intestinal glands which is hallmark for this particular mucosa element. Other than this particular mucosas or this particular lamina propria in this layer which is this particular large intestine may have accumulations of the lymphoid aggregates, which we have seen lymphoid aggregates present in the ileum predominantly, which are present in the submucosal layer, which is not present in the mucosal layer. So, mucosal layer which consists of the three layers, cell layer, then we have this lamina propria, then we have this muscularis mucosae. Now, in this particular large intestine, this lamina propria layer which is having this kind of accumulations of the lymphatics which is present in it. So, that particular lymphatics which is present in this particular lamina propria layer, that means it is present in mucosa. So, mucosal lymphatic aggregations which is kind of like a present in the large intestine, and that particular mucosal aggregations or aggregates are more predominantly seen in the vermiform appendix. The vermiform appendix is basically a lymphoid organ. So, this particular lymphoid organ has plentifully formed when we were young. As we have grown, this particular lymphatic which is accumulated in here was gradually regressed, just like thymus gland. We have this thymus gland when you were young, before first decade of life. As we progresses through the life, this particular lymphatic aggregations, whatever it was there, was gradually regressed. Similar thing happened in case of this appendix as well. The lymphatics or lymph node aggregates were plentifully seen in young children. As we progress to the second decade of life, this particular lymphatic slowly regresses, and later on it is replaced with the fats. But small accumulations of the lymphatics is always present. So these lymphatics, if they are enlarged, they block the lumen of this particular appendix, or inside of the lumen of the appendix, and they can, if the infection is severe enough, they can clog the blood flow to it as well. So that leads to the appendicitis, which is more common in the children or young individuals. As it progresses, the incidence of this acute appendicitis gradually becomes less. So that's the reason for it. But anyway, so these are the things which you are going to see. So when you are going to see this mucosa have got like epithelium, which is having kind of like columnar cells and interspaced by plenty of goblet cells. So this particular large intestine, in this mucosa we see more and more goblet cells plentifully seen compared to the small intestine, the goblet cells which are present but less. This one is plentifully, we see the mucus. So more mucus secretions are coming from the large intestine as this food particle moves from this particular ascending colon, transverse colon, descending colon, and it is getting into wrapped into the undigested food material and prepares the feces. Then if you go down to this submucosa of the epithelium, you may find the presence of these lamina propria, which contains the cutaneous connective tissues, blood vessels, nerves, etc., etc. Addition to it, we might see some of the aggregates of the lymph nodes which is present in here. Then we have this particular muscularis mucosae. The muscularis mucosae may be bridged, may be continuous, depending on the part of the abdomen which you are taking, part of the large intestine which you are taking. Then we have the submucosa. Submucosa, if the lymphatics are there, they are large, breaches to the submucosa as well, and also it has got like a glands if it is present in it. It having this particular presence of this particular lymphatics as well, nerve, etc., etc. Then we have the muscle layer which have got same two layers, and then we have the adventitia. So this is how this orientation is there, and this particular region we are not going to see this particular villi as I have mentioned, but we are going to see this invaginations of the mucosa, which is known as crypt of Levercon, which is filled up with connective tissues and as well as the glandular element. So the overall mucosa, in case of this small intestine, there was a bulginess there, which is known as villi. Now these villi are not going to be in here. What we are going to have this invagination, which is known as tubular glands. We call them as crypt of Levercon, which is present, right? And this particular lamina propria, this layer may have accumulation of lymph nodes. Then we have this muscularis mucosae, which ends this particular mucous layer. Then we have the submucosa. If you have lymph node present in here, that may breach or go down to this submucosal layer as well. Then we have this particular muscle layer, and then it have got like a adventitial layer, which is present in this particular large intestine. So to start with, mucosa having this particular lining of epithelium, this epithelium which is simple layer and one layer columnar kind of cells, and number of the goblet cells, that is mucus secreting glands, are high. Then absence of the villi but presence of the crypt of Levercon intestinal glands which is present in here. So this is about the mucosa, and within this particular mucosa we may have accumulations of this, the accumulations of this particular lymph nodes which is present in it. Submucosa may have this particular connective tissue which is present, and if this particular mucosa have got lymph nodes, they may be encroaching here. Then muscle layer doesn't have much in inner circular, outer longitudinal, then serosa. So this is how it should be looking like the large intestine as microanatomy is concerned. So this downward invaginations, which is known as crypt of Levercon, which is filled up with plenty of goblet cells, as you seeing here, and on the surface epithelium stratified, this is a simple layer, column cells interspaced by goblet cells, which you see at white dots like that, which is not picking up any stains on it. So this particular layer, as you see under to this particular crypt of Levercon, we might see accumulation of this guy, which is lymph nodes. Now this particular lymph nodes, if it is enlarged, it may breach down to the downward layer. This layer we call them as submucosa. So if it is enlarged, gradually it cannot move up, it will be dropping down. So, this gland, if it is infected, may be enlarged and occupying this particular lamina propria of the of this mucous layer, and maybe this submucous layer as well. Then we have the muscle layer, then we have the adventitia layer. In adventitia, we might see accumulations of the fats like droplets like this, as I mentioned, this one, right, which is known as the tinea epiploicy, which is fat packs like this. So, this is a overview of the large intestine which you having this. So, colon have got 4 layers as it is: mucosa, submucosa, muscle layer, external. Mucosa, columnar cells, absence of the villi, lamina propria may show lymphatic aggregates, and these simple tubular glands, we call them as crypt of Levaquin, they are present. So, these are the hallmark to identify. Submucosa may have these glands and may have these lymph nodes as well if it is enlarged. Muscle layer, inner circular, outer longitudinal, and this adventitia may have this particular fats which is present on it. So, this is pictogram, like it should be looking like this, 10x zoom. This is nearly like 100x zoom which you are seeing here. This is even more farther zoom that you are seeing here. This white dots, as you are seeing here, these are mucus secreting goblet cells. They are plentifully found in this region, and remarkable feature, there is no bulging up. So, only downward invagination is there. This is the crypt of Levaquin which is present in the large intestine. We do not have this large intestinal specimen with us today, but we have this particular thing, we call them as vermiform appendix. We know this particular vermiform appendix, the gross things about it. Also have the same 4 layers as we are seeing here. This particular appendix have mucosa, and mucosa have got like a same lining which is known as the simple columnar epithelium interspaced by goblet cells. Then lamina propria, the hallmark for this lamina propria is plenty of lymphatic aggregates which is present in it, which is this particular mucous layer having this. Muscularis mucosae may be there or may be breached, may not be completely present, and this particular lymph nodes may encroach to this submucous layer. So, lymphatic aggregates may reach to this submucous layer. Then we have this particular layer, muscle layer. If it is present, we can see muscle layer, very thin muscle layers present usually, because you can see this particular girth of this particular appendix. This is not very thick, like see that it is really thin. So, this particular muscles, as muscle is concerned, is not that great compared to the large intestine that what we are going to see. So, compared to this particular large intestine, this particular 2 layers in this region is very much visible. Mucosa and submucosa, they are very plentifully found, and this circular layer, inner circular, longitudinal, some of the specimen may have it, some of the specimen may not have it. Very good, keep that in mind, because processing time we might lose some of the muscle fibers, and serosa is there as it is. So, this particular appendix, which is a part of the large intestine, have got same age old layers, which we see that predominantly the mucosa and submucosa and thin muscle layer which is present. Some of them specimen may have all the layers, some of the specimens may not have this particular external muscle layers or adventitia layer. So, they may be losing this particular specimen when you are seeing this particular. Ideally, this particular histology of this particular appendix should be looking like that. So, we will be starting from the lumen side, then we are going to see this mucosal side. Mucosa is having lining epithelium cells which is invaginated, we call them as intestinal gland or crypts of Levaquin. Then this particular thing is lamina propria occupied by this circular element, we call them as lymph nodes. Then we have this particular absent or maybe breached, this muscularis mucosae may be fragmented, as you can see. This is, if it is enlarged, may encroach down to the mucosal space which may be occupying here. Then we have this particular muscle layer thin out, not that great, because this particular organ is itself very tiny, small organs, and while you are preparing this specimen, you may lose this muscle, as this particular thing is doesn't have that much of skeletal or not muscle girth in it, and this outer layer which is holding in here serosal layer. So, this is a schematic picture, and in real pictures you will be seeing something like that. So, lumen side you have to identify, then you have to identify this mucosa, then epithelium layer, then these glands, and then you have to look for these collections of these lymph nodes, which should be looking like this, not like discrete one. Maybe this is maybe obscure, the margins may not be very clear, right. So, you will be seeing here this particular enlargement of this particular lymph nodes may be huge, may be popping to or dropping into this submucosal spaces as well, and this muscularis mucosae may be breached, may not have very clear discrimination. And then this external muscle layer and adventitia, if it is there, If you zoom this particular layer, then it looks like this, circumscribed, like a ill-defined borders you will going to see, and this particular layer right below this particular gland, intestinal gland, you are going to see. This is a hallmark for this particular vermiform appendix. So whenever you are identifying, this is a specimen of appendix, as this is a specimen of large intestine, have got like a 4 layers from the lumen to outside. They are mentioned the layers, the absence of this particular villi and presence of this particular crypton liver cone, and this mucosa having lymphoid aggregates which is present in it, and submucosal layer which may be occupied or breached by this particular layer, and then muscle layer and adventitia, right. So we have this specimen like projected in 3 or 4 of them. Just go and see, try to see this particular thing in sequence, above, down, from the lumen side and to underside to it. See this, take a picture and then try to analyze this particular thing, which is which layer.